Hey guys, welcome back to Lovin Meets, or should I say Lovin Teeths? Because in this interview, we spoke about all things teeth with Dr. Anas Aloum from Hikma Medical Center. It's a family-owned business, and the guy is the best in the biz. He spoke about veneers, he spoke about teeth whitening, who needs it, why you need it, if you need it, you don't really need it, and honestly, what he said is little is more. Little is more. I think that's the way it goes. But anyway, listen to the interview if you are interested in knowing more about your pearly whites.
Hey guys, welcome back to the Lovin Dubai show. Today we're joined by Dr. Anas from Hikma Medical Center, a family-owned business with a legacy spanning 40 long, amazing years. The team at Hikma Medical Center pride themselves in safe and efficient dental care through high-end technology and innovation. So if you have questions about teeth, get them in now. We have the man to answer them. Welcome to the show. Thank you so much for
Thank you
joining
very
us.
much. Thank you.
Welcome. And I must say, your pearly whites are absolutely pearly white.
Thank you. Well, I'm a dentist. I should, right?
Yeah, of course. Like your work should also reflect on you, no? Like,
A little bit.
For a lot of professions.
Yeah, I mean, not necessarily though. Isn't that what they say? There's a famous saying of what is that saying where like the carpenter's door is always like jammed or something?
I don't know.
Yeah.
I mean, if you're a chef, are you cooking at home? Probably not.
You're not?
I don't think so.
What's the point of being a chef then?
It's true.
Okay,
Yeah.
today we're talking teeth, and actually, teeth is a big topic in Dubai. People have
Yeah.
these like famous, teeth are a big topic. But Hikma Medical Center has been in the business for 40 years, which is amazing.
Yeah.
Where did its roots come from? How did it begin?
So my dad and my mom both are dentists, and they started 40 years. The clinic was in the house.
Really?
That was in Abu Dhabi, where Abu Dhabi was still like there was almost nothing. You can imagine Abu Dhabi 1983. So it was the clinic was in the house, and the living room was the patient's waiting room. I remember I was one, and I grew up to the sound of the handpiece. You know, the sound that people hate the most.
And there probably weren't trends back then for teeth, right? It was just
No, it wasn't.
maintenance.
It was more primary health care, like primary care. So if you have pain, you go to the dentist. You know, if fillings, extractions, that kind of stuff. I think so. Yeah. But my dad was doing very well. He started doing implants in 1987. Believe it or not, dental implants, where people now talk about implants like it's a new thing. Yeah.
Your parents must have been so proud when you followed in their footsteps and went down the dental route.
You should ask them. I don't know.
Mom, Dad.
I'm sure, like when your kid goes down the same profession. But like Casey said, back in the days, like the practices used to be so different. Like before it was all about teeth whitening.
That's true.
Right? And now it's all about like veneers, the perfect Hollywood smile, a lot of implants.
So dentistry went through phases. So from the 50s till now. The first phase was dentists were obsessed about what we call occlusion. So when you bite your teeth together. And that was a phase. I studied in Los Angeles, and I studied in what are the hub of occlusions, called USC, University of Southern California. And that's where the biggest mentors, the gurus of occlusion were actually from there, Stewart and McCollum and Stallard. So if any dentists hear me, so gnethology. Anyways, so gnethologists were started from there. So everything was about occlusion. Dentists used to grind teeth just to get your occlusion by. They used to believe that you'll get divorced because your teeth are not aligned properly, occluding properly. That's how they were mental at that time.
Painful.
Yes. and then now we're going through a phase where we stopped that phase, and now we're into this phase of, unfortunately, dentists and we're obsessed with teeth being so wide that there's a lot of grinding of teeth also because of aesthetics or cosmetics. So now we're going the opposite. Before we were function, and now we're aesthetics. Too much, I think.
It's such an interesting evolution. So now, what are people asking for when they come to you? Like, are there trends, are there services? And what is kind of the most common procedures that you guys are doing?
Well, I mean, people always ask for, nowadays, everybody wants nice white teeth, you know, especially with Corona times and Zoom meetings, and everybody used to look at their teeth and look at how yellow the teeth look
Or
like.
disproportionate,
or
uneven, unsymmetrical.
Yeah, that actually boomed dentistry even more with or what's happening nowadays. Even in Europe now, where a lot of like in Germany, where nobody would care about white teeth. People are like the new generation. Everybody wants white teeth because everybody wants to look good on camera. So it's becoming a trend. Yeah, but we do a lot of that, but we do a lot of implants also, dental implants.
Can you explain what an implant is, just for?
Okay, so dental implant is the fixture, is the screw. So the screw goes inside the bone. I know that hurts. That sounds like it hurts. And then on top of it, you've got the crown, the white crown. So two parts, the screw and then the crown. So usually we do it for people who don't have teeth or they have issues with their teeth. Some people have hereditary problems with caries, with decay. Some people have decay like there's no tomorrow, like every tooth is decayed. Rampant caries, we call it. It's because the bacteria in the mouth is so dominant that even though they clean their teeth, they still get decay. So they say, oh, my genetics and so on. It's just not genetics. It's basically your oral flora, the bacteria, is so dominant that you get caries or decay no matter what you do. Those are the best candidates for implants because implants don't decay.
But doesn't your tooth inside, like, or the tooth is removed? Because some people have that chipped tooth and like the original tooth is still there, right? Or is it removed before?
No, the whole tooth is removed with the root.
Okay, it's removed and then it goes on the screw and the crown.
Yes.
Okay.
And that happens a lot actually. Believe it or not, there's so many. Especially, we've got baby boomers, millennials, and baby boomers are the most that have missing teeth. So I see many of my patients are 60, 70, 80 years old.
Oh, wow.
Yeah, so a lot of my patients mostly are that. I don't see so many young because I don't like to grind teeth. I don't like to do I prefer to keep your own teeth if possible, but some really have.
Well, that would be a very interesting piece of advice for people because people are getting these veneers, but actually in terms of long-term mouth teeth health, it might not be the best route. So
that's true.
Can you share your advice on veneers and how much it might actually impact someone's mouth?
This is the problem with our profession, unfortunately. Our profession is procedure-based. The more you do, the more you bill. But a lot of times, the less you do, the better. The less dentistry is the better dentistry. And unfortunately, I have to say, for people who hear me, that there are studies where actually cities where there's no dentists, those have the best health because there's no dentists. That's sad to say, but because unfortunately we create more problems sometimes, especially with and there's so many dentists now, and universities are graduating so many dentists out there that people actually sometimes grind teeth when they don't have to. So if you can avoid it, better to avoid it. But sometimes we have to do it. But that's when the best times are. And at least have an informed decision. I always say, listen, I'm going to grind your teeth, and you have to understand, whatever I grind is not going to come back. It's done. We try to do as less as possible. Now we have a lot of tools that we can do less removal. So many tools now. But still, you're adding a layer on top. So that's where you got to go see somebody who's good and who's honest.
Well, you have me as a new client.
Yeah.
That's for sure.
I mean, like the trajectory of dental care, right, from braces to Invisalign, now veneers, it's just kept evolving in such like enhanced ways each time. But what are the list of services that you guys provide down at the clinic?
So anything that has to do with oral health or anything that involves dentistry, starting from pediatrics, kids, from age of 6 months or 1 year all the way to 16, and then anything that involves after that gum health, so periodontics, orthodontics, braces, Invisalign, extractions, oral pathology, anything all the way to the most aesthetic or cosmetic, which is veneers. So
how would you say you guys stand out compared to other clinics in the country with your services?
I mean, I can only speak about myself. I'm a consultant. I'm a double certified. I did pros, perio. I'm a lab technician. So And we've been in Abu Dhabi for 40 years. You know, my dad started, my mom, and I see generations now. Like I see grandkids and grandkids. So that's nice because and my dad has always been very strict. He likes word of mouth, but it's just a matter of that we have managed to keep our patients through generations, and this is what matters to me. I love that. I love the fact that I see grandkids still, and that's where the trust is important. So you have to find somebody who's certified. You want to take your car, you want to take it to somebody who's certified in Porsche or in Mercedes, because you don't want to take it to anybody just because he's cheap or he's got a nice Instagram account. You don't want to do that. It's just your mouth.
Being a family-owned business is clearly a big part of the identity. Do you think that's important?
I mean, it's the fact that I was born with dentistry always in the house. So, I mean, that makes me more in the business all the time. So I know everything that involves dentistry. And I do teach dentists. I give a lot of courses to dentists all over the world. So I'm always in contact with dentists. And yeah, of course that helps, for sure. But there's a lot of dentists and my friends that they don't come from generations of dentistry. And they're still fantastic. So it helps.
So I'm a rookie with dental work. And when you go into a store, before you get cosmetics, you try it on, you get a sample.
Yeah.
So do you guys provide test drives for that perfect smile?
Oh, for sure. This is one of the tools that made us, as I told you, to lessen the amount of grinding that we need. And as you said, like if you want to build a house, you want to see how it looks before, right? 3D Max, any of those softwares. It's the same thing now in dentistry. We have softwares that make you see how you would look. And in 2-dimensional and in 3-dimensional fashion. And then we take all this information, all this data, and then we print it out, because there's a lot of cool gadgets now, printing, milling, all this new stuff. And then we can actually try it in the mouth before we even do anything. So you can have a look of how you would look like before you even start. In 2-dimensional way, like simulations, 3-dimensional on a software, and then even take it to the real world.
And then you can choose to have it more customized and...
Absolutely. We can even customize now, like I can put my teeth, exactly my teeth on somebody else. And I've done it many times.
Oh, so do people come in with requests like we want the Jennifer Lawrence smile, we want the Casey Fitzgerald smile from Lovin Dubai?
Yeah, as long as I have the data. If I can have the data, so I need a scan of that person, then I can do it. I can absolutely do it.
How do you go to a celebrity get their scan?
Well, I have some scans of really like celebrities. We managed to circulate from my friends STL. It's called STL file. It's a file that just teeth. So we can take those teeth and put them. Sometimes it fits, sometimes it doesn't.
Which ones?
Well, I've got Tom Cruise. Well, I don't know.
Tom Cruise smile.
Yeah, I know the dentist who treated Tom Cruise, my friend actually, and the technician too.
Okay, from the females?
No, female Scarlett Johansson.
Oh, interesting. But like this high-end tech and innovation is crazy to me, and it's so cool. Like how far things have come. One thing I keep hearing about is these one-day implants, and how you can transform smiles. Like, is that as good as it sounds?
It is. No, I'm serious. I'm not selling things now. We can actually place implants and put the tooth within 5 hours. You can actually come in with no teeth or with really badly destructed teeth because of decay or gum disease. The teeth are really wobbly or whatever it is. And then we can take the teeth out, place the implants, and give you teeth within 5 hours, maybe 24 hours, you can have teeth. And
We're talking about removal and...
No, fixed. Everything's fixed. Like you can actually chew an apple on.
So people coming in with no teeth, you will give.
Yeah,
so
all the time. I do this on a almost daily basis. Almost.
Wow.
So what I'm getting from this is that go into your clinic with absolutely no preconceived as in treatments that you should get a consultation, and you guys will recommend the best way to go about. Yeah. Also now I just want to ask like a few tips, since you're such a veteran in this field for
I'm not that old.
Oh, because you've seen it for years. You've grown up with this, okay?
I understand.
Fine, I'll take it back. You're not a veteran.
That's all right, that's all right, that's all
From
right.
this rookie.
I mean, yeah, I'm matured.
Matured. This matured
Yeah.
doctor. So can you give us a few tips on, how to maintain a good smile, good dental hygiene?
Sadly, I have to say, as a dentist, as I say, the least dentistry is the better dentistry.
So interesting.
Yeah. The less amount of dentistry you do is the better for you, unless it's really needed. And that's where you have to be smart enough to know, with your dentist, of course, you got to sit and understand. Like, if it's cosmetics, I have to sometimes remove. Is it really worth it or no? So if you can do the least amount, is the better, for sure. That's the number one rule. The least, the better. I would do the same thing for me, the same thing for my kids. It doesn't matter. I'll do the same thing. The least amount of dentistry is better. But, try to see the dentist more often, just because a lot of times we can catch things early. As simple as that, really.
See the dentist as much as possible, or as often as possible. You grew up surrounded by Hikma Medical Centre. You've seen its evolution. You've seen the evolution in the industry. What is the legacy you hope to achieve, your family business hopes to achieve with Hikma Medical Centre?
I really hope to still being able to keep doing dentistry until I'm older. And I like to see...
An actual vet.
Exactly. I like to see families and generations come in, because that makes me... Because our work is very human. There's a lot of human interaction. I just meet you, and then suddenly you're right here, and I'm in.
It's very up close.
It's very close. Yeah,
Yeah.
We are. Probably us and the barbers are the ones who are that close. So I always say that to dentists: you have to be friendly, and smell good and feel good, because you just met somebody, and suddenly he's right. He's literally, you're invading the personal space. We are violating that every day. So.
Oh yeah, you don't want a doctor with bad body odor coming. Yeah, I get that. Yeah.
No.
So you have like a selection of perfumes.
Yeah.
So
I have that always in front of me. Always.
So do you ask the customer, like not customer, the patient,
Yeah.
choose which perfume you want to smell today?
No, that's up to me.
How can people get in touch with you? Where are you located? What's the best way to reach out if they have questions, first and foremost?
Social media is maybe the better way, through mine, Anas Aloum, or through Hikma Medical Center. We're in Abu Dhabi. We've been there for 40 years. So Hikma Medical Center, that's where I'm staying at. And social media maybe is the best way.
Amazing. Dental health is so interesting and so important. Thank you so much for your time.
Thank
It's
you,
great
really.
to get your insights.
Thank you so much. Thank you.
We really appreciate it, guys. That is all we have time for in the show today, but we're back with you tomorrow morning, same time, same place. Massive thank you to Dr. Anas.
Thank
Goodbye
you.
from me.
Thank you.
Goodbye
Thank you.
from me.
Bye-bye.